Booster shots for all adults could be available by Thanksgiving after Pfizer asked the FDA for emergency approval this week. Moderna is expected to do the same in the coming weeks, as new data from U.S. and Canadian studies show protection from both shots against moderate to severe COVID symptoms declined somewhat 6 or more months out. But while many of us are looking ahead to a third round of shots, many others are still fighting over the first. A coalition of 10 states filed a lawsuit against President Biden and his administration yesterday in an effort to halt the federal vaccine mandate for most healthcare workers. And over the weekend, a federal judge temporarily blocked Biden's broader mandate for vaccination or weekly testing for all private businesses in the U.S. with more than 100 employees. And although a new poll shows 80% of adults in the U.S. have gotten at least one dose of the vaccine, 13% say they'll likely never get the shot. Now, I assume that group includes Green Bay Packers quarterback Aaron Rodgers. He was fined this week by the NFL after he tested positive for COVID for breaking the league's safety protocols by attending a party despite being unvaccinated, a status he admitted he misled many people about. I'd guess the 13% also includes many of the people behind the baffling backlash over Big Bird. Yes, that Big Bird, talking about getting his shot.
I feel okay. My wing hurts a little bit, but that's okay. You know, I was scared, but it did go by really quickly.
And by getting the vaccine, you'll be helping keep yourself, our friends and neighbors, and me safe and healthy.
Ted Cruz calling that propaganda. Well, many of us have people we know and love, and they might be in that refuse to be vaccinated group. So with the holidays right around the corner, how do we handle the balance of safety and harmony at the holiday table? Joining me to help navigate those tough conversations are Dr. Lakshman Swamy, a critical care physician at Cambridge Health Alliance and instructor at Harvard Medical School, and Amy Pisani, the executive director of Vaccinate Your Family and Advocacy and Education nonprofit, co-founded by former First Lady Rosalind Carter. Welcome to both of you, and happy holidays. Here we go. We're gathering around the table. I'm going to start with you, Amy. We were chatting before the show started, all of us, about how last year we were desperate to see each other, and we weren't able to because we were desperate for a vaccine. And now here we are, many of us, the majority of us vaccinated, but we still have these holdouts. What's up with people?
You know, it's confusing, and I think it's really more difficult when it comes to your own family, because you want to be respectful and you love your family members, but as a caregiver of your own children and your own family, it's really your primary responsibility just to keep your nuclear family safe. And so these difficult conversations, I think we're going to be moving towards, but you have to have an answer in tow. And for me, is if you're not vaccinated, I'm sorry, you can't come into my house.
Dr. Swamy, we're also not just talking about going to people's houses and family members and friends. You know, again, we want to be clear that the breakthrough infections are rare, and if you're one of the unlucky few to get a breakthrough infection, you're less likely to die from it or be hospitalized from it. But you're still, many of us, going to more grocery stores, traveling by air, in cars with people for long periods of time. There's still risk out there, even for someone like me who's gotten all of my vaccinations and the booster, right?
Yeah, you know, thanks. That's exactly right. Unfortunately, there is still risk, but the vaccines are incredibly effective and offer a huge amount of protection. Even just having gotten the 2 doses for many of my friends and family, I feel confident that they are safe and that they really can engage in a lot of aspects of semi-normal life, right? I mean, I think that we have made leaps and bounds in what I would consider extremely safe compared to last year. So although that risk exists, I think being vaccinated does so much to protect us.
Amy, I want to talk a little bit about negotiating the family dynamics a bit. In a good year, I don't know that we all trust our family 100% to tell us the truth. That's why we have prenuptial agreements. That's why wills are contested in court. I mean, there's a long history of humanity fighting with family over things that they thought they were going to get, or bonds and words that were given to each other. But at the same time, I was out on the streets interviewing folks about this week, and the amount of sadness that came out from people sharing how they were just so disappointed that either their family wasn't going to be open with them, they didn't trust them, or they weren't going to go because, as you said, if you couldn't prove you were vaccinated or do a daily test, we weren't going to get together. How can we kind of represent that to people who may be hesitant or reluctant or refusal completely to get the vaccination?
Well, it's all about trusted messengers. And I know we've been hearing that really. It's almost like you don't want to hear it anymore. But the truth of the matter is every community has their own trusted messengers. And it's really the battle is at the community level. We can't just come in on high and frankly, the mandates may be making people a little bit more reticent. And I think we needed a little bit more time to have these conversations before these mandates happened. And I appreciate the meaning behind the mandates. And I know it was an effort to get people vaccinated that were not willing, but millions of dollars were spent on research last year to try to help us understand how to speak to someone who may be hesitant to get vaccinated. And we know now the answers, but it seems like everyone's really dug in now on those political lines, and it's really unfortunate.
Amy, I want to follow up on that a little bit further, because it's an interesting point, which I hadn't considered until this week, where this push to mandate, which I have been for and I've been pushing for and supporting, but it may actually move, if that's possible, the discussion of vaccination into an even more political realm than it is already. Is it too late for that now, or should we just still keep working on the non-political message of it's science and it's a vaccine that's safe and you should protect your family, or are we just in that political world now forever with it?
I hope we're not in there forever. I mean, we do know that it tends to be on the far ends of the political spectrum. So it's not one side or the other. It's people who are at the far ends. So if you're a Democrat, far left, if you're Republican, very conservative, they tended to be a little bit more, they question vaccines more. So it's not a party line necessarily that we're hearing in the news. In my opinion, though, I just feel like we just jumped ahead a little bit too quickly. We only had the vaccine available for a couple months. We were doing really well. Everyone was gung-ho to get vaccinated, and lose people. When they find someone they know, it's like people have to have their own experiences in order to really understand it. They don't understand statistics.
Dr. Swan,
in their brain.
Yeah. If we compare the COVID vaccines to the flu vaccine, right, and that's not a mandatory vaccine for kids or lots of health workers until recently. I mean, I know some hospitals would require it, but it's been a major success. We have had an amazing amount of compliance in people volunteering to take the COVID vaccine compared to the flu vaccine, which, in a normal year kills anywhere from, the flu kills any 20,000 to 65,000, and many people don't get the flu vaccine, which has been around for many, many years. Are we missing the messaging on that when we're talking to folks who aren't getting vaccinated? Like, look, we're all on board here. This is a great success.
I think we are missing the message a little bit. I mean, it's interesting to compare it to flu vaccination because there are a lot of people who don't get the flu vaccine. The difference is that you don't have the flu kind of like burn like wildfire through an exposed population the way you do with COVID. And we've seen that so much, right? I really think what it comes down to is exactly this point of communities. But I mean, maybe I'm biased here, but I think a lot of this has to do with, we need to connect people with their primary care doctors. People need to be talking to healthcare professionals in their lives. Why do I say that? I mean, if you're having chest pain at home, you're not just going to sit there and endure it. You're going to call for help. You're going to go to the emergency room. You're going to call your doctor. Same with shortness of breath. You're having pain of whatever kind. You're not looking to the internet for solutions. You feel the emergency. And I think if you trust us then, trust us with this. So just call the doctor that you already know. And if you don't know one, now is the best time to set that up too.
Yeah, Amy, I want to build off that, because one of the things that I think, another one of the inequities that we've discovered during this pandemic is how many people that have access, have insurance, have privilege, have all the abilities and toolkit to have a doctor, don't have a doctor. And I was struck a lot by the messaging to young adults. Go talk to your doctor. And many young adults don't have a doctor and won't have a doctor until they're sick or, trying to get pregnant or, any number of things that happen when you're in your late 20s or early 30s. Is there an opportunity here for messaging to people about getting connected with a primary care physician who you see or connect with it once a year to hopefully reduce the amount of other chronic illnesses that we have, which are preventable?
Absolutely. The Vaccines for Children program provides free vaccines to children who can't afford them up to age 18. And it has been such an amazing opportunity for our country. It almost eliminated the disparities among children. We don't have that for adults, and young adults particularly. You're right. They don't go to the doctor. They're not ill very often. But when it comes to COVID, the vaccine is free. It's at every pharmacy. To not get a vaccine for COVID at this point is really just, it's available. Community health workers are out there, particularly in rural areas. All of these clinics are open. That's an entree, and they should be asking. It's not just that you need your COVID vaccine. We missed millions of doses of HPV vaccine last year. And we're looking at a potential for cervical, oropharyngeal cancers among young adults, 10 years down the road. There's a lot of vaccines that we have to start getting back on track with. And, measles, we know we're low on measles for our babies. So our country needs to wake up.
So, Dr. Swaby, as we close here, just some tips. So you're going to the relatives, you can't get out of it. You're vaccinated, your kids are vaccinated. You don't know who is or isn't vaccinated. You've asked them to prove it or tell you, and they're just giving you the cold shoulder. Should you keep your mask on while you're in the house for dinner? Should you just go back to pre-vaccine protocols?
Yeah, I think this is a situation that so many of us are going to find ourselves in. We're really struggling with these family dynamics. We feel the pressure. What I would say is you have to ask yourself, will I feel comfortable with my kids in this setting? Is there any way I can make it more comfortable? I think if you're going to be in those settings, honestly, if you are vaccinated, that goes a really long way. It would be wonderful if everyone was. It would be great to get the first shot in. I know we won't get kids fully vaccinated by Thanksgiving, but at least that first shot does offer some protection. I would say, you have got every family, every situation is different. I think it's very reasonable if you're having multiple families together to be wearing masks. I think it's awkward, but I think it makes a lot of sense. I think it makes sense to try to ventilate better. If you have the ability to have those air purifiers, to do all of that stuff, it does make a difference. But it is hard. It is hard. And I think that if whatever you can do, it does count. Whatever little bit you do matters.
And I imagine it's also important to have a post-exposure, even if you're not having any symptoms, testing. And if you're traveling, have a plan of how you're going to quarantine if you have to, if you're out of town, right?
Yeah, I think that, especially with more and more people returning to the office and all of that, I think that it's important to understand that you may be putting yourself in higher levels of risk, especially, we're lucky in Boston and Massachusetts. We're pretty lucky, right? We've had it better than most other states. And I think as we gather with people from those states, we have to be conscious that this is really something different, that we are encountering, different populations here, and we should probably take extra care.
All right. Well, I hope that you both have a joyous holiday season.